so we can do intros all together.
Great. So thank you very much, everybody, for coming along to the COVID Community Champions Forum today. I'm Anya Gopfer. I'm a public health registrar working at Torbay Council, and I work alongside Lex and Sam, who you can see in they're managing the chat, and here in the Zoom call, they're the people who help coordinate the Champions programme. So today's forum, we've got some guest speakers. So I'm going to do a very brief introduction again to just what is being a champion and some update on Torbay's figures. And then we've got Joanne Watson here from Torbay and South Devon NHS Foundation Trust to give an update on the hospital situation. And then David Gledhill is here to talk about the helpline that's being run in the communities. Sorry.
Anya, can I just stop you 1 second, because someone's just written a comment saying that they can't hear. Can I just ask people to put their hand up if they're also having any? So put your hand up if you can hear, I guess, would be.
I think it's often they need to turn, it's their own speaker sound, isn't it? Or the sound on
I'll just let Tasha know we've just done that check then.
Okay, no worries, I'm going to carry on. So this is what we're going to cover today, and what I'd like to use the last bit of today's session to do is get a little bit of feedback from all of you around what being a champion has been like so far, whether the sessions that we're delivering and the bulletins we're delivering are useful, or whether there's anything that should be done differently moving forwards. So first of all, a little bit of webinar etiquette. If you could stay on mute unless you're talking. If you want to speak, please raise your hand and I'll show you how to do this in a minute. We may turn your video off if the signal is poor to help with the hearing, the sound. Please use the chat function. You can post questions in the chat or respond to other people's questions if you have a useful or helpful link to share. It is an open forum, so we just ask that everybody is friendly and kind and takes everybody else's concerns seriously. And if you want to ask something privately that you don't want to share with the wider group, you can email us at champions@torbay.gov.uk. If you have a question, you can write it in the chat, and if you want to raise your hand and speak your question, you can click on participants at the bottom left of your screen, click on raise hand, and this will allow us to see that you want to speak, and we'll then bring you in and unmute you or ask you to unmute when we're ready for you to talk. So what is it that we're asking of COVID community champions in Torbay? So you as an individual will have many networks of people with which you interact. These are your family, your neighbours, your friends and your colleagues or anyone in your work environment. And all of your family and all of your neighbours and friends and colleagues have their friends, their neighbours, their family and their colleagues. And so what we're trying to do is share with you the latest and most accurate factual information about COVID-19. And then we're asking you to share these resources, this information and the credible links that we provide you with within your networks to ensure that everybody is accessing the best quality and the most accurate information that they can. We're also hoping that you as champions are feeding back to us the things you're hearing from your networks. So problems that people are facing, concerns or questions that you're getting asked a lot, and ask you to feed those back to us either in these forums or by email. And then we can use that intelligence to direct what content we do in our future forums and in our bulletins. And that's what we're asking, is essentially you to share the information both to your networks and then share the information you're hearing back with us. And just to flag that being a champion is actually, if you attend this forum, that's great, but you need to also sign up on the website to make sure that you receive the communications from us that we send out by email. So if you've got to this forum but you're not yet signed up as a champion, then please go to this link and just sign up as a champion, because that way we can also send you resources and bulletins by email. So I'm just going to pause for a second. Does anybody have any questions about being a champion? Great. I'm going to move on, but if something comes up later, feel free to flag it. So what's going on currently with COVID-19? This is in Torbay specifically. So what we've got here is the current cases in Torbay. And you can see in red is the start of the November lockdown. In pink is the end of the November lockdown. And in orange is the start of the current lockdown. So our current rates for Torbay is 348 cases. The number is 348 cases, which gives us a rate of 255 people per 100,000. And if you look at these rates, there are has been an increase, although we might be starting to see a bit of levelling off as an early indication that the lockdown is having some effect. The lockdown came in at a good time for Torbay when our rates weren't as high as many other areas in the country, meaning that it's likely that cases will be less, hospitals will be less overwhelmed in the Torbay area than potentially they have been elsewhere. Here's the rates for each area within Torbay. So we've got Brixham in blue, Paignton in red, and Torquay in green. And you can see that they are still rising up to the 8th of January with more rise in Torquay, which is because there have been a couple of care home outbreaks in Torquay. And here we've got Torbay compared to both the Southwest and England as a whole. You can see that Torbay still has lower rates than both the Southwest average and England overall. Does anybody have any questions about the current COVID situation in Torbay? Okay. I'm going to move on to very briefly just touch on vaccinations. I'm not going into any detail at all here, but just to give you a couple of pieces of information. There were some questions provided by some of the champions prior to this session about vaccinations. Unfortunately, we're not allowed to share a lot of information about vaccines. So what I'm providing here is some of the shared communications that we can provide at the moment. So apologies if all of your questions aren't answered. So as you're probably aware, we now have 2 vaccines which are available in the UK, the Pfizer-BioNTech vaccine and the AstraZeneca-Oxford vaccine. And there are priority groups which are currently being prioritised for receiving the vaccine are the over 80s and healthcare workers. As you'll be aware, over Christmas and New Year, the government announced that the second dose of the vaccines is going to be delayed for up to 12 weeks to allow us to vaccinate more of the population with the first dose of the vaccine. And if you want to read more about this, I've put the link here of the decision around why this has been decided. In Torbay and across Devon, the vaccination programme is underway. So across Devon, the 4 hospitals, GP practices and care homes are the places where vaccinations are currently being delivered. The clinical commissioning group is the body which is leading on vaccinations. So the public health team and the local authority are supporting the vaccination programme, but we are not leading it. And just to flag again, you will be contacted by your GP when it is your turn to be vaccinated. We're asking people not to get in touch with their GP surgeries to ask when it will be their turn, to allow them to focus their resources on getting people vaccinated in turn. And just to flag, if you've been vaccinated or if you could share with your networks to make sure anybody who has been vaccinated, it's really important that people continue to abide by the rules. That's social distancing 2 meters and face coverings as everyone else, even after vaccination. So this is for several reasons. First of all, we know that the immunity to COVID-19 takes some time to develop. And the second reason is we don't know if vaccines prevent transmission of the virus. So although they may prevent the individual from getting seriously ill with COVID-19, we don't know if the vaccines prevent transmission. So it's really important that anybody who has been vaccinated continues to adhere to social distancing rules and face covering rules after vaccination. Does anybody have any questions about what I've just said?
There's none in the comment box at the moment, Anya, and I can't see any hands up at the moment.
Okay, well, we've got more time at 4 o'clock for question and answers. So if anybody thinks of anything to do with vaccines that they'd like to discuss, then feel free to ask after we've had our other speakers today.
Tanya, can I just quickly add something in?
Sure.
We had some questions that came in, which I thought were really, really insightful questions, actually. The ones that we haven't been able to answer in the forum, I have forwarded on to the CCG, who are managing the rollout of the vaccine, and a couple of the points around whether or not we can share a sort of a weekly rate, how many people are getting vaccinated, has been cropping up quite a lot. People are quite keen for that response at the moment, and at the moment the national direction has been that we shouldn't be doing that locally. Whether that will change is beyond our reach, I guess. So just to let you know, we haven't just gone, oh, we can't answer that, and ignored you. I have forwarded it on, and I am trying to seek those answers, but it might take us a little bit longer.
Thanks, Lex, for that clarification. So I'm going to move on and ask Joanne if you could come in now and give us an update on the situation in the hospital.
Joanne, you might be on mute still.
I think I would know by now that I'm on.
Do you want us to take up the sharing so we can all see you and you can introduce yourself?
Absolutely. So it's good to be here. I like the fact that Torbay Hospital is so much part of the community, and to look at those numbers and the data that Anya was sharing, I feel very much part of that, seeing how we compared to the national numbers, to the southwest, and where we are in Torbay. And you will have noticed that we do have low numbers, and we have responded really well to the other lockdowns that we've had. And I'm really hopeful that our third and this really kind of tight, tough lockdown is going to help us again. I'm talking to you as a medical director at Torbay Hospital, which means that I'm one of the doctors who is helping to coordinate and lead us through this really tough winter. Winter's always a tough time in the NHS. If you think back to last year and the year before, there was very much in the news about how busy EDs were and how long the waits were. And that is typical for winter. And it seems such a long time ago when that was our only problem. And this year, of course, we've got the same issue in the sense that our hospitals are so busy, but we've got the added issue of COVID instead of our usual winter illnesses. And one thing that those graphs translate into is that if we've got less COVID here in our communities across the Bay and in South Devon, we will have less people coming into hospital. So when you see on the news how busy London is, how busy Essex is, we are not in that kind of situation. And my other part of my job is actually, I'm a consultant physician here at Torbay Hospital, and I am actually, indeed tomorrow, I will be working with our COVID patients on our COVID ward, looking after those people, the very people that we're sort of looking at that graph and seeing that they had contracted COVID, and some of them, quite a small proportion, have come into hospital. And so we're not overrun. Our ITU is not full, but we are looking at the situation and watching those numbers every day, because we are busy and we are working hard to keep our patients well looked after, but are mindful that we could be getting more as well. But I have learnt that many people get better from COVID as well, and that number of people who are dying from COVID as a percentage is getting smaller, and it's really rewarding to see that. I remember treating people back at the beginning, back in March and April, and we didn't have the treatments that we have now, and it is great that we every month we are making a stride with being able to help people to get better, to recover, and to go home as well. It feels like a real success story. I got an email this morning from a woman that was with us before Christmas, and she was just letting me know that she was feeling much better and was on the road to recovery. it's a real pleasure to get that sort of thing. So we are using the Nightingale Hospital here in Devon, and I just want to really be really clear about the Nightingale Hospital in Devon. We were the last Nightingale hospital to actually be set up in the whole country. You'll remember the one in London was the first one. That was a really big one, and it was hardly used at all. And we watched what happened with those big Nightingale hospitals, because they were really being set up as intensive care units, and they weren't necessarily as useful to the local population as say a hospital would be. So we've set up the Nightingale Hospital for Devon, which is in Exeter. We've set it up so that the hospital can look after people with COVID. They only look after people with COVID, and we are sending some of our people from here, from Torbay Hospital, up to the Nightingale. And we are sending them, if it is safe, that we can get them safely into that hospital. And we are sending them if we think that they will get the same level of care that they would get in Torbay Hospital. So these are people that have only got COVID, they don't have an additional problem as well. And we are hearing really good things. We've got staff from our hospital here in Torbay working at the Nightingale. We're hearing that the Nightingale is a nice place to work. We're hearing that patients are doing well there, and that we're really very pleased that we've got that extra resource in Devon. So, and all the hospitals in Devon can refer into the Nightingale, but we know it's an extra resource for Devon, more hospital beds, so that we are more protected than we would be if we were getting those kind of numbers that they are getting in other parts of the country. We've also got, we use all of our hospitals as well, so people who need to recover. We've also got people who are recovering from COVID who are at Brixham Hospital as well. And we have to be really careful, because we have to separate our COVID patients from the patients who don't have COVID, because we really do not want anybody to get that extra infection while they're in hospital. So our infection prevention measures are really strong in hospital, the same things that we talk about out there in Torbay, in the country, hands, face, space, those are doubly important within the hospital, as well as the fact that we have extra PPE when we're dealing with patients as well. So if there's one thing which I am constantly talking about, and reminding our staff that we need to make sure that we don't catch the infection and that we don't give it to anybody as well. So lots and lots of cleaning. I was just noticing this morning how much my hands were smelling of like a swimming pool at the moment, from all the disinfectant wipes I've had in my hands, and the alcohol gel, and washing our hands. So we're really trying to make sure that we are obeying those rules all the time. And we're setting up long COVID services as well, because that's something we didn't necessarily know about at the beginning of the pandemic. It was an illness that affected breathing, and we had to really concentrate on that. But of course, there will be a number of people who do not make such a good and strong recovery, as the woman I was talking about earlier on, that some people have the long COVID and they need some help as well. So I always feel that we're just with COVID, we've got so many extra things to be thinking about here in the sort of the healthcare world. We're thinking about how we manage COVID per se. Actually, I'm going to take a step back and talk about, the COVID champion kind of work, about COVID prevention. Really important. I'm really pleased to be part of the COVID champion network, and anything that we can do to help prevent infections is really important. We've got our COVID pathways and the COVID treatments that we do in hospital, working alongside primary care, because most people don't come into hospital. It's a small proportion of our overall cases, but they do need a lot of treatment very often when they come in. But we are pleased that we're getting better at that treatment. We've also got the long COVID to think about. And really a big thing that's on my mind as a medical director is how we also keep healthcare going, all the non-COVID work, which is actually bigger than COVID, but is so affected by COVID, just like our lives are affected by COVID and what we can do on a daily basis. The fact that we can't deliver the services in the same way because so much of our resource has to be taken up with looking after COVID and keeping people as well as possible. So I feel that my start to 2021 was just so different to 2020, when we knew there was something happening in China, but we didn't quite know what was coming, and we wondered what it, would it spread over here, and just how much the world has changed in those 12 months. The vaccine is just such a great light, a real light at the end of the tunnel for us to be working towards. And I think that the responses in Devon, from what I can see in the Bay Area and wider Devon, just a great program. I'm really proud of the NHS. I think this is something we are doing really well, is a vaccination program that this is going to give us an opportunity to stop those effects of COVID, causing people to die prematurely and in great numbers as well. So I'm really excited about the vaccine. I have had my vaccine. I had my first dose here at the hospital last week, and we're halfway through vaccinating our whole of our NHS workers here at Torbay and South Devon. So it is that light at the end of the tunnel. It does feel that this is the hardest wave to go through, though. The numbers that we're seeing in London and to the north of here are phenomenal, and I am very grateful that I am not working in those kind of hospitals, but I do know that I'm doing my part here in Torbay to get us through this bit as well. And so with spring coming, I think that we will be able to see the back of this, the numbers, always watching the numbers, but we've got reasons to think that we could get through this. And when we're vaccinated, getting that magic herd immunity, we will be able to say that we're on top of this. So COVID, it won't go away completely with the vaccine, but I think it's reasonable to think that this could be the last and biggest wave of COVID coming through at this point in time. I feel that I sort of said a lot there. I hope that was interesting to you, and I'm really happy to take any questions if that sort of works at the moment. Tanya, shall I hand it back to you and Lex and take it from there?
Thanks, Joanne. We've got a couple of people agreeing with it, that saying how interesting it is and how great it is to hear something optimistic as well. I've got two questions maybe that I haven't quite got round to in the chat, but first of all, I can see Councillor Chris Lewis has got his hand up. So shall I come to you first, Chris?
Yeah, many thanks. Unfortunately, I've got to leave at 5. We've got a leadership meeting for the council on COVID. With Caroline Diamond. First of all, I'd like to say well done to Joanne and all the staff at the hospital for all the good work they've done over the last 12 months. Brilliant. With the opening of the Nightingale Hospital, Joanne mentioned it, but how many day-to-day operations that the people from the Bay would normally go have been cancelled? And how many people are we actually directing to the Nightingale to free up beds for those sort of day-to-day basis at the hospital that we're very aware of, that even without COVID, we've got a very high proportion of elderly people in the Bay that need help on a day-to-day basis. So how many people have been directed to the Nightingale to free up beds for the day-to-day job?
Thank you. So I am sort of in that middle of that. So where we are at the moment is we have about 30 patients with COVID actually here, between here, and I'm at Torbay Hospital as I speak, here and in Brixham Hospital. So 30 patients with COVID in the hospital. And since the Nightingale opened, and that was sort of about the beginning, you know, you lose track of time, don't you? But I would say it was around the middle of November. And in that time, we've sent less than 20 patients at this time. You'll remember that we got that dip in December when it was really, really fantastic that we got down as low as we did at the beginning of December. So there were very few patients in there. It's building up at this point in time. We had at Christmas, we had about 25 patients in the Nightingale. So that was from Exeter, who've had a much tougher time around COVID in the second wave than we did down here. They're mainly from Exeter, some from us. About 25 people were there before Christmas, and that number's going up to around 45 now in total, and we will probably get up to about 100 people at the Nightingale Hospital. The hospital is full. It's winter. This is the usual time that we have a really, really busy hospital. So we actually don't necessarily, it's just the way the sort of cycle works in the hospital's year is that we don't do a lot of elective operations during January. So the beds that the Nightingale is freeing up for us is actually being used by those winter admissions that we expect to see. And we are starting to have to cancel some of the surgeries as well because of the pressures on the whole hospital system. And it is a big worry to us about the non-COVID work and how we get on top of that, because that's still mounting up. And we have been really good at keeping the cancer work going here in the hospital. It's been things like joint replacements, so a hip operation, knee operations, that have borne the brunt of the waiting list for us because of not being able to do non-COVID work.
Thank you for that, Joanne. Sorry, I have to leave you. Barbara will carry on. She'll go to the next room on her computer. Thank you very much indeed.
Thank you.
Thank you, Chris. We've got another question around long COVID. Someone asked how many people in the Bay have long COVID. I've given a bit of a data answer in terms of the ONS survey, suggesting about 1 in 10 people with symptoms have symptoms of COVID for longer than 12 weeks or more. But I just wondered whether you could add anything to that in terms of your COVID referrals that you've had, whether it's too early to say at the moment.
And it is a bit early to say, and I think that's a really helpful statistic to give, Lex, because 1 in 10 is actually I see that as a patient of COVID. It is worth mentioning that long COVID is a variety of diseases. So it can be confined to extreme lethargy and that post-viral fatigue that people get, and we do see that in other with other virus infections. And then it could be chronic effects on the heart, chronic effects on the lungs as well. So long COVID, we are learning, is a big spectrum of diseases. And so we are only at the beginning. I know that we are getting about 8 referrals a week for our population that we serve in the Bay, 285,000 or so people. So that is quite a significant, 8 doesn't sound like much, but when you mount that up, these are people that the GPs are worried about and saying, we do need help to manage. So we know that that's another service that we need to be developing.
Thank you, Joanne. And then final question that's come in so far has been that this came in over email prior to today's session. People are concerned, and so am I, that in the Torbay area, our figures, although slightly increased, are still one of the lowest throughout the country. However, we have been told that we have to receive people with the virus from outside. So I think that's receiving people into the hospital, into your hospital estate, which will mean our figures will increase. And in addition to this will also mean that there's less bed space for residents in the area who need hospital treatment.
And that is you know, it is a fact that you know, the NHS is open, and we will treat people that come in through the doors wherever you live. And actually we see that in non-COVID times, we will always be having a percentage of our people who are from different areas as well. That is less. The vast majority of people that we are treating for COVID in the hospital are people that that are local and are not from anywhere else in the country. I know that we've got a few people who are from out of area, but it is a small number, just to reassure people.
Thanks, Joanne. And I would add into that how incredibly robust the hospital's infection control processes are. So we would not see this as a risk in terms of increasing infection in our local area, because it is so well managed and contained.
I'm going to take the credit for that, but I've appreciated the you know, that's on behalf of Torbay. You know, and certainly the other way round is I've also got you know, tales that I could tell about people who have travelled away into other areas and caught it while they were in those high infectious areas. They live here, so of course they've come back, but you know, they've done the travelling away, caught it, and then come back as well. So I'm not throwing you know, what's the word, you know, people in greenhouses shouldn't throw stones. You know, I try really hard to stick to the rules and wear my mask and socially distance. I do know that there are some reasons why people have had to travel to see family as well. So you know, it's a real privilege to be a doctor, because you get to know so many people, you know, stories that people tell you about their lives and why they were traveling as well. So it works both ways.
Okay, great.
Any more, Lex?
We've got one more that's just come in. So we are not admitted COVID patients from other health authorities transferring from a hospital. So I think.
Oh, that's a really, really good question. So yes, we have. We are we have taken not many, three patients, perhaps four, from other hospitals up country. So this has been around. You will know how short of beds they've been in intensive care units in around the country. And the thing about COVID is that it often gives people quite a long stay in hospital. So the average stay for being in hospital is, you know, is short, you know, 3 or 4 days, something like that. The average stay for COVID, if you get the full-blown pneumonia, is, you know, 10 days. And if you go to ITU, it's significantly longer. We're into weeks and months there. And so ICUs can get very full, and we have taken people from the London area. We've taken somebody from Somerset into our ITU, and we've been helping Derriford as well. So we have been asked to use our ICU capacity to help the rest of the NHS. We currently have a very low number of people in ICU here at Torbay, so we have been able to help, but we are watching the numbers, because it's really important that we don't, that we have flexibility in our beds as well. So we've been pleased to help, but we also have to be careful with just watching about what we think our bed usage is going to be.
Thank you so much, Joanne. We have got another question, but it's not a hospital focused one, so I'll save that for the general questions. Are we able to keep you for a little bit longer, just in case there's more?
I would love to stay, because I do really feel very strongly about, you know, we've been a success together, the hospital is part of the community. So I'm really, really pleased to be part of this, and of course I'll stay.
Brilliant,
Thank you.
thank you.
So now, just like to bring in David, who's from the community helpline, and David, I'm just going to swap you for Joanne in the. Oh, there we go. David, would you like to give us a summary of the helpline and what it is that you can do and how people can find you?
Sure, thank you very much for inviting me on. Just reflecting.
David, we can't hear you very well. Do you want to just...
Is that better?
Yes, that's much better, thank you.
Okay. Just following on from what Joanne was saying, I too am very proud.
We've lost you again. Hang on.
Hang on.
That's better.
We'll try that instead then, shall we?
Yeah, that's
How's
great.
that?
That's much better.
Okay.
Thank you.
Just following on from what Joanne said, because it is very important and it's becoming a little bit of a hackneyed phrase, but we are all in this together. And as someone that is relatively new to the Bay, I have observed the people of Torbay react heroically to this pandemic. If I can just take you on a short journey, back in March 2020, about 3 lifetimes ago, we huddled in the back room of the Torbay Community Development Trust and said, okay, what can we do in preparation for this? So a week before lockdown, we launched what was then called the Torbay Community Coronavirus Helpline. And the response was incredible, absolutely incredible. We didn't know what we were doing. I'll be absolutely honest on that. We just knew that we needed to help and we needed to coordinate that help to the best of our ability. Torbay Community Development Trust deals with lots of vulnerable people. So we thought we were best placed to look after those vulnerable people as we went into the first lockdown. And I think it's proved to be true. If I told you that since we launched the helpline, we've now had more than 16,000 calls. At the peak, they were coming in at the rate of about 300 a day. And we have helped just short of 4,000 people. We've also managed to find around 1,000 people that have been helping their neighbours. At the core of what we're doing, it's putting people who are close to each other in touch with each other. And we have provided a rapid response service so that people who have run out of drugs, if you remember back in lockdown 1, the queues that were snaking around the block outside pharmacies, it was absolutely crazy. And you remember the toilet rolls being cleared from the shelves in supermarkets, along with just about every dried food available, including flour. So we provided a team of rapid responses. It was a mix of staff and volunteers that went out and did shopping for people. There were lots of issues right back at the beginning because everybody assumed, well, you were given warning, you should have got your food in. Well, not everybody can afford to stock up the larder, and that became apparent very quickly. So we were also involved in helping to set up the Torbay Food Alliance, which is a group of food banks from across the Bay who have since the beginning now distributed more than 325,000 food parcels. They are now going out at about the rate of 10,000 a week, because with each lockdown comes a fresh bunch of furloughed people. And these are people that didn't see this coming. Food poverty has become a huge issue, not just in the Bay, but across the country. And these are people who didn't know they were about to lose the job, and suddenly found themselves in the position of not being able to feed their families. So the Torbay Food Alliance came about. It united the food banks from across the Bay. But then as things progressed, it also became apparent, and it shouldn't come as a surprise, but it became very apparent that people's health and well-being, particularly mental health, was suffering really rather badly. And so we now provide a triage service for mental health. We also provide a triage service for financial advice. We have telephone befrienders who literally just pick up the phone, perhaps once, twice a week, have a chat, and it takes people out of isolation. I like to say that under our watch, no one in the Bay has gone hungry or has become isolated. And that's a very important part within the background. And it's allowed us to keep getting the messages out all the time. Last Friday, on the subject of vaccinations, I put out a call. Sorry, my job in all this is communications. That's my specialism. And at 4 o'clock on Friday afternoon, I put out a call for volunteers to help marshal people arriving at the Riviera Centre and to act as chaperones as they go into the Riviera Centre, as well as finding more rapid responders, more shoppers, more good neighbours, for want of a better way of putting it. And when we opened the phone lines on Saturday morning at 9:30, we'd already missed 60 calls, and in the next 2 hours we took 150 calls. All people wanting to help. I mean, it brings a tear. Those are tears. When we reopened the phone lines on Monday morning, we received another 240 calls, about half and half, some people needing help, some people offering help. And by Monday tea time, we had 200 people willing to stand out in the freezing cold at the Riviera Centre to marshal people in and out as quickly and as efficiently as possible. It's been an incredible journey. It's a journey that I'm very proud of the rest of my team for achieving, but even prouder of the people of Torbay for stepping up. It's been phenomenal to watch. If I told you that, to my shame, just 3 weeks before all this started, I wrote a column. I write a weekly column in the Herald Express, and I was bemoaning the fact that volunteers were becoming a rarity. How wrong was I? And I am happy to eat my words, more than happy to eat my words. It's been amazing. The people of Torbay and COVID champions, or our volunteers, or the NHS, we are all in this together. And I think that's why we're doing so well. I really do. That's about it.
Thank you, David. I have to say this forum has been very uplifting from the depths of lockdown. That's a really fantastic story of how people have come together to support the community. Lex has helpfully been posting the details of the helpline, so the phone number and how to find an online form for support. Are there any questions, Lex, or any comments from the chat?
I stupidly put myself on mute. Yeah, there's just one question around how it is that what population you're referring to. Who do you find that you generally get requests for support from? And in terms of feeling confident that no one is going lonely or hungry, how can we be confident in Torbay that people are accessing the support that they need?
A very good question, and it's one that worries us always. At the beginning of the crisis, I managed to get a leaflet through every letterbox in the Bay, in theory. Obviously some would go astray, and we're doing exactly the same again next week. We are pushing out to 40,000 letterboxes the leaflet, just to remind people that the helpline is there. We are relying entirely on good neighbours. We have now nearly 70 good neighbour schemes that didn't exist before all this started, and that is literally just people watching out for their immediate neighbours or the person who lives further down the street. In Torbay, as I'm sure a lot of people will be aware, we have a unique population in as much as we expect at the next census, when it rolls out, we expect the result to show that the number of people over the age of 50 exceeds the number of people under the age of 50, which are phenomenal figures. It means that everything's skewed in one direction. And because of Ageing Well Torbay, which has been running in the Bay for 5 years, we thought we knew where most of the over 50 vulnerable people were. I don't mind admitting we didn't. We now know where an awful lot more are, but we are reliant upon people looking out for each other. And from what we can see, that is happening. At the beginning of lockdown, or this latest lockdown, we're still getting new people that we haven't seen before at the rate of about 100 a week. But at the beginning of lockdown, we were seeing them by the 1,000. So we think we're getting there. I constantly, I'm on radio, on TV, in the newspapers, appealing for people to come forward, either for themselves or for someone else, because it really is important. Your neighbours at the moment are the most important people in your lives. You've got to look after them.
Thank you. I've got Councillor Barmby's got her hand up. Do you want to come in, Jane?
Oh, thanks, Alex. Sorry. Yes, thank you, David. You do a phenomenal job. Just one little thing is that when we very first started the COVID Champions, we were asked if we would volunteer. I did get registered, and no one's ever asked me to do anything. I wondered if that's the same around the Bay.
I'm happy to say that's as a result of us being overwhelmed.
Fine.
What I'm doing this time around, Jane, is every week I'm going to send out a newsletter to say what we are doing, what we are doing with the volunteers, and why we need you to hang on, because the rollout of the vaccines isn't going to be tomorrow. It's not going to be next week. We are going months into the year with the best will in the world. So we want people to be on call, ready. And if we can't use you, believe me, that's a good thing.
Yeah, that's fine. That's fine. Thank you. And brilliant. Well done.
Thank you.
Thank you. Which segments us nicely into the next question was, does the helpline still need volunteers?
We are desperate for people to actually staff the helpline. We've actually reached the crisis point whereby the calls are still coming in so quickly. We have 6 people on at a time, between 10 in the morning, 6 in the evening. We can't keep on top of it. We are negotiating at the moment for extra lines, and we are also trying to work out how we can step back just for a day or two to train more people. So the answer is yes, please ring that number, register your interest, and I really hope that we can resolve this one.
Great. So just to clarify, if people want to sign up as volunteers, they use the same number as the helpline to register their interest.
Yes,
Great.
yes, please.
And I've shared that in the chat. So
thank you.
Great, thank you. Lex, is there any more questions?
Not that I can see at the moment.
Okay, so I'm gonna move to kind of open question and answers now. Joanne and David are still both here, and it's kind of time for people to be able to ask anything you've currently got on your mind, or maybe people have been asking you and you're not sure how to respond to it, and we can bring in the most appropriate person to answer that particular question if people have them.
So
It's Nigel. Can anybody hear me this time?
yeah.
Oh, thank you. It's working. Sorry. Two quick questions for, I think, was it Joanne from the hospital? What is the situation regarding patients having to stay in hospital with or without COVID, regarding a single visitor can have or not? And the other thing I was interested in, that she said that around 50% of staff have already had their first injection. What is the situation if they refuse to have one? I'm pretty sure we all understand they probably won't, but I know from past experience, they don't always have the flu jab.
You're okay to go in, Joanne.
What a great, I'm really enjoying that. I was hoping somebody would ask about visiting. You know, one of the things is not having the footfall into the hospital. So we reluctantly have to say it is the right thing not to have visitors in the hospital. We are not as strict as I know some other hospitals are about no visitors. So we absolutely do allow visitors even to even to the ward where we have our COVID patients, if that's going to make that huge difference to them, particularly if sadly they're in their last days of life as well. So we have we're very clear, we hardly have any visitors in the hospital, but each ward sister or ward manager, we would, if there were particular reasons, we are absolutely letting people come in, but it is very, very restricted. And people have to wear the personal protection gear while they are here as well, regardless of whether you're seeing somebody that's got COVID or not. And we'd ask you not to come if you had any symptoms that could possibly be COVID as well. Now, your other question was about people not having the vaccine. So we have absolutely, the vast majority of people are wanting to know when they can have their vaccine. So I'm expecting that we will get to a very high percentage of people that have the vaccine. I know that myself and other colleagues are taking queries from a really small number of staff, just asking, is it safe? Would you have it? What about this? We've heard about that. So we are absolutely facing those head on, and I am very clear that I have no hesitation. I had no hesitation to have the vaccine. I do not want to get, as we were talking earlier, the risk of getting long COVID really worries me. To go through the illness, to risk getting long COVID, potentially dying, and also the fact that we are getting back. I do think it's likely to be the ticket to getting back into normal life. We just wonder if you won't be allowed to go on an airplane if you haven't got proof of vaccination. That's a personal opinion there. So I think the number's going to be very small. We are not allowed to mandate it. So we have no ability to say, if you work in the NHS, you have to have the vaccine unless you have a medical reason not to have this. That isn't actually within our legal framework to be able to do that. We know that we need to get to society, herd immunity. We start to see it when we've got 20%. It really builds. So we want it over 70% of people to be vaccinated in total. I would like to see that much higher within the hospital, because we're the people that give the care. We're the people that are moving between people and quite literally are very up front and personal when we're working in the hospital. So I think it's going to be a small percentage, smaller than flu vaccine, because you're right. 30% of people here don't get the flu vaccine in an average year for a variety of reasons. I don't hold much truck with that position, but I can't make people have the vaccine.
Thanks, Joanne. Really clear answers, I think. Lex, what have we got in the way of questions? I noticed that Councillor Barbara, I can't see your surname, I'm afraid, has her hand up.
Yeah, should we come to her next, and then we can go through the ones on the chat.
It's Barbara Lewis, Chris's wife. I'm councillor for Roundham with Hyde. Just a couple of questions regarding vaccinations, really. My mother, who's 94, is in Roundham Court, and there's another care home at the other end of the road, which is Harbour Rise care home. I've spoken to the owner of Harbour Rise, and he's had all his care home patients vaccinated already. They were done the other day, whereas my mother's home hasn't. How do they prioritise which care home gets it first, or gets it, basically, is the first question.
Lex, do you want to come in on that one?
This is a really tricky question for us to answer, Councillor Lewis, because it's being managed by the CCG, and the messaging that comes out of it is quite limited at the moment. And as you can appreciate, it is a very large logistical task, which is a balance between making sure you reach the priority group in order of our 1 to 9 priority groups, versus not wanting to waste a single dose. So there will be a mixture, I expect, although I haven't seen a prioritization by criteria by single care home level, but I suspect it will be predominantly a logistical process, by which, for example, the Pfizer vaccine, which we have been using thus far, has been our main vaccine access. Joanne, please come in if you're more updated than I am. it is logistically incredibly tricky, because you have to keep it at what's called the cold chain. You have to keep it incredibly low temperature, but also it's once you've put in, you mixed it with your reagents, etc., you can't travel with it. So you wouldn't be able to you couldn't take your box and go into 2 care homes, for example. So you'd only be able to
right.
homes which were of a sufficient size that you could go in and have no wastage. So it is, it's a logistical operation, which is tough, but I think they're doing a great job. So we do have to have some patience, I'm afraid. We have to have confidence that they are doing the best, the most effective, with as little wastage as possible at the quickest speed they can.
The thing is, trying to explain that to a 94-year-old is extremely difficult.
Of course, really appreciate that. And we're pushing constantly for more messaging, actually, because I think that's really important.
Yes, yeah. I mean, she keeps asking me daily, when am I going to get it? I've signed the form. When am I going to get it? When am I going to get it? It's very difficult to go. And the other question is, there is a young girl that works in the care home, and the girl's mother said, "You're not having it. You're not allowed to have it. You can't have that." If somebody like that refuses to have the vaccine, does that mean that they cannot work in the care home, because obviously they're more at risk of giving it to the patients?
So I think Joanne's response, the response that Joanne gave in terms of the healthcare staff, would apply in the social care sector as well. But we are not a country that mandates vaccines, and there's very good reason around that, because of the evidence base for mandate. If the evidence base thus far shows that if you mandate vaccine, if you make it law that someone has to have a vaccine, what you do is you drive vaccine rates down, not up, because you increase hesitancy around that. Anya, Joanne, would you want to come in with anything else? Are you happy with that as a...
Joanne, I was just going to say, and I think Joanne needs to leave us, and just say thank you so much for making the time today. It's absolutely great for the champions and for this forum that you were able to come along. So thank you very much.
It's been a pleasure, and I'd just like to say to everybody, I do hope you keep safe. Get your vaccine when it comes. Everybody else that they should get their vaccine as well.
Great.
Take care, everybody. Bye-bye. Thanks for having me.
Bye.
Can I just ask one quick question? It's regarding the pods. You know that most of the care homes now have got pods outside of the care homes. A lot of them have said they can be used, and a lot of care homes have said, no, you're not allowed to go in them now because of the new outbreaks and everything. How safe are they? I mean, obviously, if you're keeping social distancing, I'm going in first, and then they're bringing mum out and putting her in the other side. So we're not actually touching each other or even near each other. Is it just a care home policy to that actual care home? Do they make their own rules as regarding that?
So yes, they do make their own rules, but we have a lot of guidance, and actually care home visiting is something that sort of is under the remit of the Director of Public Health. So she sets a local policy around care home visiting. I think in terms of how safe something is, I think what we have to be really clear about is you cannot categorically say that anything is totally safe at the moment. No. So there's lots of things that we can put in place that reduces risk, but you're constantly trying to do a risk balance, aren't you? You're trying to weigh up the likely risk. So if a care home does have a current outbreak, that might shift their thinking in terms of visitors, and it might then, I'm trying to think of the better word of saying it, but the scales of risk tip slightly in the other direction. I'm just thinking, Anya, that actually care home visiting might be a good thing for us to cover in our next bulletin.
I'll make a note of that. I'm just going to say
it would be helpful, because, as I say, I have to go round to where her window is. She's on the first floor, and I have to talk to her through the mobile phones just so that she gets, a visual look at you and that. So I think it impacts on their mental health as well as their physical health when they can't see someone or talk to someone.
Thanks, Barbara. I'll do my best to address that in the next set of communications as well.
I
just want to quickly try and address a few of the remaining questions that we've got from the chat.
David's got his hand up.
David, can I come to you in a minute, just because there's a few questions that have been there in the chat a little bit longer, I think. Yeah. So the first one was from Eileen around why the press have been reporting so negative, because Joanne has given us a really positive story from the hospital. And I'd like to say a little bit on that, and then Lex, I don't know if you want to add anything as well. I think that it's very difficult to capture everything that's going on in any hospital in terms of in the press. Also, it's a very rapidly changing situation. But what I think we can very confidently say is that Torbay have done very well, that residents have really rallied together and helped each other, have really done their best to abide by all of the social distancing and other regulations in order to mean that that Torbay and Torbay Hospital are managing this situation as well as can possibly be expected currently. Lex, do you want to add anything to that?
Yeah, I probably just that reminder that we're in a pandemic that is affecting the entire country, the entire globe. So when you're watching the national press, it might be reporting on what's happening in other areas. And actually, what I think is really important is that we don't disregard that. We were really fortunate. I think it's down to all the hard work that people have been putting into Torbay that we started our rapid rise. Started from a much lower baseline, so we are not seeing here what is abundantly clearly happening in Essex, in London, and in parts of the north. That doesn't mean it won't happen here. We're really hopeful it won't, because lockdown came at a really good time, and we think that our local community are doing everything they can, and as everyone keeps on saying, we're working together to keep our numbers low. Our hospital is in a really, really good position, but that unfortunately that is not the same across the country.
Thanks, Lex. There are a couple of specific questions about businesses and business testing kits.
Yeah. So Joe, I'm gonna ask you to I'm gonna give you an email. If you can, I'll write it down. So that because this actually testing for businesses is quite complicated. So I'd be really happy to understand what the purpose is, what the ask is around that, so we can best advise you. In terms of the benefit of special UV lights, I would say that there is not an evidence base around that. Ed's asked a question about are all the vaccines done through the GPs? No, so there is some in-setting vaccination going on in care homes and in healthcare settings, and also the Riviera Centre is a vaccination centre, which I think opened today or is opening very shortly. If a child is sent home from school or someone in the school bubble is positive, is it necessary for the parent to self-isolate? No, it is not. You only contacts of cases need to isolate. The parent in that scenario would be the contact of a contact. They would only need to start self-isolating if their own child started to develop symptoms, or someone else who they'd been in close contact with was a positive case.
Thanks, Lex. I was just going to flag as well that somebody had asked whether there are any mental health and wellbeing resources. So Amber has just posted an amazing list of things in the chat for anybody who wants to have a look at those. And I've just captured those that they'll come out in the slide pack as well. So we put some in the bulletin last week, and there's some more in the chat there as now. David, do you want to come in with your question quickly?
Yeah, the one question is, I'm sort of like a go-to person on this side of the bay. A friend of mine, 97-year-old mother, has not only had her first vaccination, but has had her second vaccination. And she's from a very wealthy area, the other side of Paynton. A friend of mine has a 97-year-old mother living here in Babbacombe. She's had no contact on vaccination whatsoever. Again, not 5 minutes away from her house, a friend of mine who's 83 has had a date for her first vaccination. It seems to be a postcode lottery at the moment. Obviously, I can't say to this person, well, they've got it down the road, you know, I've just got to sink this information in and sort of like report back to you guys.
If I come in on that, David, what I can do is I can share your concerns with the CCG. As I was saying, I think it was to Barbara around that there is the logistical operation as well as the strategic get to the highest priority first. In terms of anything further, we're not really in a position to comment, so I will feed that back into the CCG if that's okay. David, do you want to ping me your direct email, and I can, if you want a direct response, I can ask them, or we can cover questions like that in future bulletins or forums.
That's smashing. Thanks very much.
Thanks.
I think, given that we're just a little bit over time, I'm going to draw this to a close and just quickly do my last couple of slides. What I'll do about the feedback is put a link into the bulletin that we send out next week. So as a reminder, anybody here who'd like to receive the bulletin, you need to be signed up as a champion. And I'll repost the link I'll share the link in a minute. So if I just share my screen. So just to quickly highlight, that's not what I wanted to start on. So just to quickly highlight the resources that are available. So as a COVID community champion, you have access to a link tree. You can see this link. This is the website link or the QR code here. That's access to resources that we develop and keep updated for the champions. So you can always go to those to look for more information about various aspects of COVID-19. Here are some websites that we recommend as credible sources of information. So the Torbay Council website, the government website, the NHS and the World Health Organization. You can also like our Facebook page of Torbay Council and follow us on Twitter to help ensure that we're reaching as many people as possible. And if you've got specific questions or queries, you can email champions@torbay.gov.uk. If you sign up as a champion, we have these forums every other week, and we have a bulletin that goes out in the in-between weeks. We try to tailor the content to the questions that we're getting to ensure that we're kind of addressing the concerns that you're sending to us. So please do send your questions in, either from yourselves or from your networks, to ensure that you're informed and you can share the information to your networks. And we also provide you with access to resources via the link tree that I just shared. So I'm going to miss the feedback bit out for now because we've run out of time, and I'll come to it in the bulletin next week. And then I just wanted to flag as well that Sam Cross, who's been instrumental in getting the COVID Champions programme up and running, is off to a new job starting on Monday. So we want to say thank you very much for all of your help and good luck in your new role. And you'll be very missed on the Champions programme. That's everything from us today.
Not everything,
Sam, do you want to say something?
It's not everything though, is it? What day is it today?
It's Lex's birthday. So it's Lex's birthday, everyone. So everyone needs to wish Lex happy birthday and say goodbye to Sam. And thank you very much for all of your contributions today to the forum. And that will be all for today. So I'm going to stop sharing my screen and we'll stop the recording. And thank you very much for coming along.